Hello friends, welcome back to Cortex YouTube channel. In this video, I will be talking about hepatitis C treatment. So let's look at the basic first. So hepatitis C virus belongs to Hepacvirus genus, which belongs to Flaviviridae family. Your dengue virus, Zika virus, uh, Japanese encephalitis virus, yellow fever virus, West Nile virus, they are all included in Flaviviridae family, and it has 7 genotypes. Thala for a reason here. Genotype 1 is most common in worldwide, and genotype 3 is most common in India, and it is the most common genotype that causes hepatocellular carcinoma and cirrhosis. And one good point about HCV virus is it never incorporates in the host DNA like HIV. So that's why it is easy to eradicate HCV. Okay. And how to diagnose these hepatitis C virus cases? It depends upon the testing for anti-HCV antibodies. Okay, if anti-HCV antibodies are present, that means patient is infected with hepatitis C virus. Or you can go for testing for HCV RNA also with plus or minus symptoms. Okay, so let's look at the different permutations and combinations. In If patient is anti-HCV antibody negative, that means patient is not infected with HCV. Okay, if patient is having anti-HCV antibody present or positive, that means he is having HCV infection, whether it is acute or chronic, or it may past hepatitis C also, we don't know. So that time we have to check for HNA RNA levels. If patient is having HCV anti-HCV positive and HCV RNA is also detected, that means patient is suffering from current infection, that could be acute or chronic, but not the past hepatitis C, because in past hepatitis C we won't get HCV RNA. Okay, if the patient is having anti-HCV positive but HCV RNA is negative, that means what it tells about RNA is not there, means it is not current infection. So it tells about past history, past hepatitis C, or it could be false positive also. Okay, uh, what if the patient is having anti-HCV negative but HCV RNA is detected? That means what? RNA is detected means it is current hepatitis. It may be acute or chronic, or it can be false negative in HIV patients and renal dialysis patients. Okay, these are the possible permutations and combinations. Okay, next question comes, whom to treat? That's about diagnosis. After diagnosis, whom to treat? So one sentence that you have to remember is, all the patients with chronic hepatitis has to be treated with DAA. So what are these DAA? DAA are nothing but acting antivirals. Direct acting antivirals. So let's talk about DAA here. So as you know, HCV is a RNA virus. So its genome has so many genes which produces structural and non-structural proteins, among which three non-structural genes are very important. So NS3 and NS5. NS5 again divided into NS5A and NS5B. Okay, so NS3 inhibitors are called as protease inhibitors, and they end with previr. So here these drugs can be remembered by GPS, that is grazoprevir, paritaprevir, cimeprevir. Okay, GPS, grazoprevir, paritaprevir, cimeprevir. So other groups of drugs are NS5A inhibitors. These ends with asvis, and you can remember them with the help of mnemonic love. So ladipasvir, ombitasvir, valpatasvir, elbasvir. Other two drugs are daclatasvir and pibrentasvir. Okay, pibrentasvir, daclatasvir. You have to remember these drugs, pibrentasvir and daclatasvir. Okay, valpatasvir you should not forget. So what are the other class of drugs? NS5B drugs. Here they are polymerase inhibitors. They can be nucleoside inhibitors or non-nucleoside inhibitors. That can be remembered by DAS. So DA stands for dasabuvir and sofosbuvir. S stands for sofosbuvir. So these drugs end with buvir. Those drugs ending with buvir, remember it is B buvir. So it is NS5B. Okay, NS5B. So B means buvir. Okay, A means asvis. Okay, protease starts with PR, so it is Previr. Okay, so this is how you have to remember. These are DAA. A lot of times this question has been asked, DAA in hepatitis C, hepatitis. This can be expected in your coming exams also. So okay, this is about a DAA examples. Now we know about drugs. We have these drugs in our armamentarium. Then how to what are the regimens that are approved or recommended? How to use these combination drugs and treat these patients? So what latest recommendations tells about is we have to use simplified regimen. So what is this simplified regimen? This is nothing but if the patient is having no cirrhosis or compensated cirrhosis, you have to use combination of drugs like glecaprevir, or pibrentasvir, that is 300 mg and 120 mg once daily for 8 weeks. Or you can use sofosbuvir and valpatasvir for 12 weeks. The dose is here 400 plus 100 mg. So that is 500 mg. Okay, these there are other drug combinations, but these drug combinations are pan genomic. When I say pan genomic, it is used for 1 to 6 genome types. Okay, you need not go for genotypic here. So sofosbuvir and valpatasvir. So this has to be used in patients those who don't have cirrhosis or compensated cirrhosis. When can I say compensated cirrhosis? That depends upon a child score. Child score A. Child A is compensated. B and C are decompensated. Okay, in decompensated we cannot use a simplified regimen. There is other regimen that I will talk about later. So who are eligible for this simplified regimen? HIV patients, HCV patients with co-infection with HIV, they can be used, and any genotype here, any genotype and not previously treated. Though it is very important that patients with previously treated HCV cannot be given simplified regimen. Okay, so that comes in exclusion criteria. So previously treated patients we cannot use simplified criteria. AG patients we cannot use because that comes in a special situation that which I am going to talk about in later videos. And compensated cirrhosis with ESRD, that is end stage renal disease less than 30 GFR, estimated GFR less than 30 ml per minute per body surface area. And decompensated cirrhosis we cannot use this simplified regimen. And current pregnancy, suspected or detected HCC, that is hepatocellular carcinoma, and prior liver transplant cases we cannot use simplified regimen. So exclusion criteria you have to remember. So HCC, decompensated cirrhosis, pregnancy is not at all used. Okay, then how to decompensated cirrhosis patients, what drug to be used? So you have to use sofosbuvir, valpatasvir plus weight based ribavirin for 12 weeks. Okay, the dose remains the same. And in genotype, that is for genotypes 1 to 6. In genotypes specifically for 1, 4, 5, 6, you can use sofosbuvir, valpatasvir, only 2 drug combination for 24 weeks. So there are other again different regimens, but these two regimens you have to remember. So this is our treatment name, decompensated cirrhosis. Okay, treatment name, decompensated cirrhosis. Why I am saying naive patients? Because what if the patient has already taken tablets? I mean, before prior history of prior usage of DAs are there. That time, what we have to do? So this is about treatment naive patients. Let's talk about those patients which have taken these tablets DA, but they have stopped in between. So let's look at those patients. Okay, those patients who have stopped tablets or interruption of during first 28 days, like you started on day 1, but within like a week or within a 4 weeks they have stopped the drugs. So what if they have missed the taking tablets less than 7 days, like they have missed a tablet for 4 days, 5 days, they'll come to you. You have initiated for a day, and because of some reason they have not taken tablets for 7 days or 5 days, 6 days. What you have to, here you have to restart the DAA again. Okay, immediately you have to restart the DAA and complete the therapy as decided up before, like 8 to 12 weeks, depending upon the which combination drugs you use. If you are using GP, it is 8 weeks. If you are using sofosbuvir and valpatasvir, that is SV, you have to go for 12 weeks. What if the patient has missed tablets for more than 8 days, like he has not taken the tablets for 10 days, 12 days, 15 days, that time what you have to do, again you have to restart the DA. But here one more additional step you have to do is you have to check this, RNA, HCV RNA levels. Okay, HCV RNA levels. HCV RNA levels you have to check. So after obtaining HCV RNA level, you will get to know whether it is positive or negative. If it is negative, RNA levels are negative, that time what you have to do is you have to again complete the originally planned the whatever you planned before, no? Before first time initiating tablets, that only continues. That plan will only continue. What if the patient's RNA becomes positive? Here you have to again extend the DA treatment for additional 4 weeks. So here you have to extend the duration 4 weeks by 4 weeks. So this is about when patient misses within 28 days of initiation of the first treatment. Now what to do? What if the patient, he has taken tablets for correctly for 28 days. After 28 days his mind has changed and he has stopped tablets. What if he has tablet for, what if he has stopped for before, I mean less than 7 days? That time you have to again restart the, you have to restart DA immediately and continue as planned. But what if the patient has missed around 8 to 20 days, consecutive days? That time what you have to do is you have to restart DA again, obtain HCV RNA again. If it is negative, complete originally planned course. If it is positive, what you have to do is again is, stop treatment and restart according to recommendations in the retreatment section. So what if the patient has missed 21 consecutive days? Like you have to stop the DA, and if HCV 12 not achieved, that means HCV RNA is not negative. That means you have to go restart the treatment according to the retreatment section. Okay, retreatment section I will talk about later in the other video, because again it will get confused here. So this is about a treatment of HCV patients, in treatment new patients and those who missed this tablets patient. Okay, those patients I have talked. In next video I will talk about like special situations like co-infection with HIV and HBV, pregnancy, children, CKD, and liver transplant patients. Okay, that will be dealt with another video. Stay tuned. If you like this video, hit the like button and share among your friends, colleagues, juniors. Thank you.